Birthday Wellness Quiz, Day 178, your Health Promotion and Disease Prevention Podcast, brought to you by Kike Afya. My name is Bidi Ubogo. I'm a medical doctor and specialist in public health medicine. In today's episode, I'll be discussing 10 benefits of weight loss in persons with type 2 diabetes. So here is a quiz for which I will share the answer at the end. If you are overweight or obese, the benefits of losing weight through diet and exercise include, that is for diabetics, improved sensitivity to the action of insulin and improved blood sugar control. B, lowered risk of developing heart disease, especially things like heart attack and stroke. C, prevention and delay of serious health conditions such as breathing problems, joint and bone disorders. D, diabetes reversal. Or E, all of the above. Now, diabetes affects the way our cells use glucose or sugar. The food usually turns into sugar, and the sugar needs it to get into cells, and that's the work of insulin produced by the pancreas. Now, diabetes is a worldwide epidemic. It's estimated that about 422 million people worldwide have diabetes, and the majority are in low and middle income countries. There are also about 1.5 million deaths attributed directly to diabetes each year. The epidemic is increasing most rapidly in Asia, Africa, and South America. Now, excess body fat is an important risk factor for type 2 diabetes. We usually define obesity as BMI over 30 and overweight as BMI between 25 and 30. There are two types of diabetes. In type 1, the body doesn't make insulin, and patients have to inject themselves with artificial insulin. In type 2 diabetes, the pancreas doesn't make enough insulin, and the insulin it makes doesn't work very well. With increase in childhood obesity, we are beginning to see type 2 diabetes in younger age groups. Now, long-term complications of diabetes include damage to nerves and blood vessels, which in turn lead to blindness, limb amputations, kidney failure, heart attack, as well as stroke. So it's important that you know your diabetes and manage it properly. Now, what are the risk factors for diabetes? One is overweight. As I mentioned, body mass index above 25 is considered as overweight, above 30 is obese. And BMI is basically the ratio of your weight to the square of your height in meters. Also, having a family history of diabetes, either a parent, sibling, grandparents, uncles, aunt, increases your risk of diabetes. As I mentioned, 85% of persons diagnosed with type 2 diabetes will have a close family member with the disease. The older we become, also the greater the risks, especially above 40 years. Being physically inactive can also increase your risk of diabetes. That is, you require moderate intensity activity, 30 minutes a day for at least 5 days a week. And that includes things like cycling, brisk walking, or running up and down the staircase. Now, ethnicity can also increase your risk, in particular Asian, African, Hispanic, or Native American ancestry. Having a history of high blood pressure, in particular above 140/90 millimeters of mercury, or if your blood fat called triglycerides is elevated, where good cholesterol HDL is below 35 milligrams per deciliter. If you've had a history of increased blood sugar, especially if the glycosylated hemoglobin A1C is above 5.7%. Being a woman with a history of diabetes in pregnancy, or having a history of delivering large babies weighing more than 4.5 kilos also increase your risk of diabetes. Women with the polycystic ovary syndrome are also at increased risk. So, how does weight affect your risk of diabetes or insulin resistance, and how does losing weight help you manage or even reverse your diabetes? Now, as I mentioned, diabetes affects the way our cells use glucose, and the food we eat is turned into sugar, and the sugar in turn needs to get into cells, and that's the work of insulin. So understand how excess weight is a risk factor for diabetes and how losing weight prevents diabetes. I'll use the analogy of insulin, that is the car, sugar passenger, and destination, the office, that is the body cells, where the insulin needs to work. Now the work of insulin is to pick up the passenger, that is sugar, and drop her at the office, that is the body cells. However, there's a small problem. The heavy trucks are blocking the highway. The highway is the bloodstream. So individuals who are overweight or obese have slightly more and larger fat cells, which are the trucks, than healthy weight individuals. The fat cells tend to block the road, are blocking the car, that is insulin, from taking the passenger to the office, that is the cells. So conversely, when you lose weight, your fat cells shrink and insulin is able to work more effectively to take the sugar into the cells. So people with diabetes who lose weight tend towards insulin sensitivity, meaning that insulin works better and they're able to control their glucose much better. So studies have looked at the effect of different levels of weight loss and the benefits in diabetics. This study was called Diabetes Prevention Program, and it shows a reciprocal relationship between weight loss and reduction in the risk for developing type 2 diabetes. People who lose at least 5% of your body weight, you can prevent diabetes. And if you're diabetic, you have better control of your sugars, and sometimes you may have to reduce your medication. There's also improvement in urinary stress incontinence, mobility, joint pains, and weight-related quality of life. There's also improvement in cardiovascular risk factors such as glucose control, insulin, the good cholesterol HDL goes up, triglycerides goes down, and blood pressure also goes up. Now, if you lose up 10% body weight, you gain all the previous improvements, plus improvement in sleep apnea and chance of diabetes reversal. Losing more than 50% weight loss, all previous improvements, plus improvement in cardiovascular mortality and all-cause mortality. Now, just good to remember that 15% weight loss can mostly be realized with surgical weight loss. Mostly, if you're using diet and lifestyle, the maximum you can lose between 5 and 10% of your weight loss. So back to our quiz, if you're overweight or obese, the benefits of losing weight through diet exercise, actually all these are benefits. Insulin sensitivity, the insulin works better, your sugar is better controlled, reducing the risk of heart attack and stroke, preventing breathing problems, joint and bone disorders. As I mentioned, if you lose up to 10% of your body weight, the diabetes can go into reversal. So thank you very much for listening. This podcast was brought to you by KK Afya. My name is Video Bogo. I'm a medical doctor and specialist in public health medicine. You can support us by liking, sharing, as well as commenting, or by subscribing to my YouTube channel. We use well wishes being with this podcast, and you can also support us using the M-Pesa till number 766500 or mobile number 0720 95 82 50. Until next time, bye-bye.